Welcome to Help Cymru Africa's Meet the Funder Week. Today we are having a lunch and learn with Bee from THET. She's going to introduce herself quick in a second, but just very briefly, I guess we wanted to let you all know that obviously it's been a very difficult couple of weeks for many of us. THET's experienced devastating loss of funding as a result of the British government cuts to the aid budget. We stand in support with THET along with all the other organisations globally that have been impacted by this. This meeting here isn't really the space to be able to talk about the cuts. We're really grateful for THET to be able to join us, and we're hoping that we can use the space to talk about grants more generally rather than specifically focusing on THET grants. THET and Help Cymru Africa are two of 5 organisations who have received funding from the SCCF Capacity Development Grant. So those grants are aimed at supporting small charities and groups and health links to support them to develop and grow. I'm going to put into the chat some more information about them both. But this event today is funded in part by the SCCF Development Grant as well as the Welsh Government Wales for Africa. So I'm going to put that in there today, in the chat now. In terms of the cuts, if you would like to talk to anybody about it, you can also get in touch with Hub Cymru Africa. Our email address is advice@hubcymruafrica.org.uk, and we'd be very happy to talk to anybody about it. I will stick that as well in the chat. So today's event is going to be recorded. If you're not comfortable with your image being available, then please do turn off your cameras and turn your names to anonymous or whatever. The recording will be on our website after this event, and you'll be able to watch it back if you need to, or share it with any of your colleagues that maybe weren't able to be here today. If you have any concerns about the event or anything that happened during the event, you can report this on our WCIA website. So if you Google WCIA and look on their website for the whistleblowing policy, you'll be able to see our safeguarding policy there and how to report. Okay, so I'm going to hand you over to Bee. Bee, could you please introduce yourself and let us know a little bit about your role, please?
Yep, sure. Good afternoon, everyone. Thank you for inviting me to speak today. So my name's Bee, and I'm a grants coordinator here at THET. So I work within the grants management team. I manage a number of our programs for THET, so that includes the Africa Grants Programme. I was managing some of the streams under the UK Partnerships for Health Systems programme. So my role is kind of developing these calls for applications and what the grants programme will look like, and then opening that up for people to apply, reviewing the applications, and then managing the grants as they progress through their cycle. Claire, are you happy for me to start sharing my screen and everything? Okay.
Can you do that?
Yeah. There we go. Can you see that okay now? Great. Yeah. Okay. So what I'm going to talk about today is I'm just going to give you quite a brief introduction to THET and what we do, and then I'm going to go through some of the kind of common areas which you might be interested in when you're applying for grants. These, as has been mentioned, this is not specifically THET focused, but some of the kind of answers and questions that I draw upon will be ones that we use in our application forms. So THET, or the Tropical Health and Education Trust, we're a global health charity. We operate in 7 countries. So we've got a main office in the UK, and we have country offices in Uganda, Tanzania, Zambia, Somaliland, Ethiopia, and Myanmar. And our primary aim is to address the statistic that 1 in 7 people globally will never visit a qualified health worker. So we do this primarily through health system strengthening activities, so things like training health workers, developing policies and protocols, and then working with healthcare institutions, including the Ministry of Health, to achieve kind of strengthened health systems. And we do this by working in partnership with organisations and volunteers from across the UK, Africa and Asia. And all of the work that we do works within the health partnership model framework. So a health partnership is a partnership formed between a UK health institution. This might be a hospital, it might be an NHS trust, a professional association, or a health education facility like a university. And they form a partnership with a counterpart overseas. It doesn't mean that a university has to partner with a university, but they both need to be some kind of health institution. And then the aim of these partnerships is to deliver health worker training and peer-to-peer support through using the skills and experience of each of the organisations involved in the partnership. So partners then co-develop programmes that will address organisational and national priorities. And the partnerships themselves are generally long-term and sustainable, whereas the projects that they then deliver together are discrete and generally tailored to really specified needs. And the aim of all of the projects is sustainable impact and mutual benefit. So we like to see some kind of benefit for both the UK and the LMIC institution involved in the partnership. So THET has got three main kind of areas of work within this. So we have country programs. So we deliver health partnership activities ourselves with our partners overseas. We have we do a lot of policy work, so we do a lot of work with the UK government trying to advocate for the benefit of health partnership work. And then thirdly, we run grants programs where we fund health partnerships to deliver work themselves. So as I said, a big part of the work which THET does and which my role is to help deliver these grants programs. So some of the programs might be quite specific. So for example, we have a program which is just coming to the end at the moment, which is funded by the Department of Health's Fleming Fund, and that is looking at building up the capacity for antimicrobial stewardship in 4 countries across Africa. So it's a very specific program, whereas we have kind of broader programs as well. For example, the Africa Grants program focuses on community health and surgery and anaesthesia, so it's quite broad. So what I'm hoping to do now is just offer a bit of advice for those hoping to apply to not just our programs, but for grants programs or health partnership programs in general. Just looking at a bit more information about the general strengths and weaknesses that we might see in applications and then what we're looking for. So I can share at the end a couple of documents that THET have developed to try and guide you through our application form and budget template as well, which you might find quite useful. Okay, so firstly, one of the key things that a lot of grant applications ask you to talk about is what you're planning on doing. So what you need to give is a clear description and summary of exactly what your project is. So we find, especially with our applications, that often it can be quite difficult to actually work out what health partnerships or the applicants are planning on doing, because they can be quite general and use a lot of confusing jargon, which we who are reviewing the applications, we're not necessarily kind of clinicians or health development experts, we might not understand. So I would advise always putting in as much detail as you can about the activities which you're going to carry out. And some of the key questions that you might want to answer are, what's the current situation on the ground? And I'm talking about the specific implementation site. So quite often we see applicants describing what the situation is in the whole country rather than in the specific hospital or region that they're planning on focusing on. And that makes it quite difficult to know whether what they're planning on doing is actually relevant. We want to know who you're going to be targeting. So if it's a project focused on building the capacity of health workers, what cadres are they? How many people are you targeting? Where are they based? What skills do they have at the moment that you're trying to build? And then what are you going to target them with? So are you delivering a particular training or building up capacity in a particular area? If you be really specific about what exactly you want, the skills that you want them to develop, then that can be really useful for us, because we know what point A is and what point B is and how you're going to get to that point and what you want to achieve. We want to know who's going to be delivering the activities. Is it going to be volunteers from the UK? Is it going to be in-country partners? It's good to know that information. And then what exactly you're hoping to achieve with, what is the end aim of your project? So you need to make sure that you're being really, you're clearly articulating all of this information. You need to think about who's reading this information. As I mentioned before, it's probably going to be especially the initial shortlisting stage. It might be a layman, it might be someone who doesn't have technical expertise in the area. It might be that it's a clinician reading it, but rather than an anaesthetist, they're a GP, so they might not know about the specific health theme that you're trying to develop. So make sure that you kind of avoid using any kind of technical jargon. Acronyms are a really big one, which people seem to throw in all the time, and it's a nightmare when you have to go through the document finding where the first acronym is so that you know what on earth they're talking about. Yeah, so that is just a general description. You need to make sure that all of these elements are within your application. So with the THET applications, we try and have a specific section at the top of the application form where you can throw all of this information, and then you use all the further questions down just to build on and add further detail. But we need to know right from the start what exactly it is that you're planning on doing. So and this, the next thing I want to talk about is the partnership expertise. This might be fairly specific. Well, it is very specific to health partnership projects, but we need to know what the role of each of the partners is, each of the institutions who will be delivering the project. So what expertise is each bringing to the table, including the clinical skills that they need, but also thinking wider. So the project management, the financial management, the monitoring and evaluation, who's got those skills within your partnership that means that you'll be able to deliver this project. It's really important that that's articulated. So fundamentally, all of the projects that we fund anyway are delivered by partnerships. But we understand that the individual institutions involved will be both bringing different things to the table and taking different things away as well. So although these projects you might think that they're all about strengthening the skills of health workers in country, you can also think about what the UK partner might be getting from delivering this project as well. What will the staff at that institution be gaining from being involved in this project? What will maybe the reputation of the institution be gaining from being involved in this project? So just a final point on this, we have had some situations in the past where applicants have included partners who don't really play a role in implementing the project, and they're included within the application form because it might be that they're quite a prestigious organisation who've done a lot of work in the health theme area. We find that if you can't specifically say what added benefit they're bringing to the partnership project, then don't include them, because it does just look like they're a pseudo partner. Okay, moving on to the justification and the needs assessment for your project. So I've kind of lumped these together, but they're kind of two distinct areas. So why are you choosing to do what you're doing, and why is the method that you've chosen going to be effective? So another key area that we find a lot of applicants fall down on is articulating the justification around why they're choosing to do what they're doing. So as I mentioned earlier, quite often we see quite a very broad justification, which might quote figures from across the whole of the target country. So for example, someone might say in their application, well, in Uganda, 65% of new mothers don't have access to postnatal care. Now, that doesn't really tell us a whole lot. If you're planning on implementing a project in, for example, Gulu, we want to not know what the situation is in Gulu, not what it's like in the rest of the country, because countries are very complex and they have a very wide range of different kind of problems or health system issues across the country. It's not a broad statistic isn't going to help us. So what instead you could say is, for example, in the Gulu district, 65% of new mothers don't have access to postnatal care. And then you could talk about how many clinics there are, how many trained health workers that are in the area that could respond to this. We need to know exactly what the situation is like before you even think about planning your project. So what we always say is that you need to carry out a needs assessment before you do any kind of work. So we do realize that it might be that a partnership, before they apply for a project, hasn't had chance to carry out a needs assessment. So what we want to see is that there are plans in place to do so, so that the partnership and THET can know that the intervention which is planned is responding to an actual need, and that the intervention is appropriate for the context, and that most importantly, I think the work isn't already being carried out by somebody else. What we don't want to see is any kind of duplication of effort. So things that you might want to consider when you're planning on, when you're either carrying out the needs assessment or you're planning to carry out one, is where are you carrying out the needs assessment? What's your target site? Are you looking at a whole region? Are you looking at just kind of one town or one hospital? We want to see that you have found the need in that very specific area. We want to see that you've reviewed the relevant literature. Kind of look at, has anything been done in that region? If it hasn't been done in that region, anywhere similar, other kind of interventions which have been done which you could draw on learning from? We want to see that kind of thing. Yeah, as I said, we want you to explore the current situation in the hospital implementation site, but it's also important to know who's carried out that assessment and how it's been carried out. So we always think that the LMIC lead partner should be taking a lead on any kind of needs assessment, because they know what the context is, they know who they need to talk to. But if the LMIC lead, and this happens quite a lot, is not the implementation site. So for example, if you were carrying out a project in Fort Portal Hospital, but the lead LMIC partner was Makerere University, and they're different institutions, we want to make sure that there's buy-in from the implementation site as well, and that they know the work that you're planning on carrying out and they can feed into that needs assessment. And they might already have audits and things in the hospital that you can draw upon. There's no point in redoing that work if it already exists. We also want to know what other stakeholders in the region are doing. Have other similar interventions taken place, or are taking place, or are planned to take place? Quite often, we want to know what the Ministry of Health plans in that area are. They might have a national policy in place, and in 6 months' time, they will be delivering work in the area that you want to, in that theme, and you need to be aware that that might be happening and see if you can work with them to deliver it. And then it's also, as I've said, really important not to duplicate work. So reach out to the other organisations that are working in the field and find out what they're doing. We really think that collaboration is incredibly important in this field of work. Sometimes you see kind of development actors taking more of a competitive approach, but collaboration is what we always like to strive for. So here is a kind of an example of a good justification question answer that we might have received in one of our application forms. So it's a strong answer for a couple of reasons. Firstly, they're highlighting their engagement with the Ministry of Health, and that's really crucial. So it shows that the project is tailored to the specific context, and that the stakeholder buy-in, and this is really crucial for long-term sustainability. They reference internationally recognized gold standard measurements. So they look at the WHO situational analysis tool. And this kind of shows that they've taken some methodical steps in terms of carrying out their needs assessment. They know the tools which already exist, and they're tools which have been used in similar circumstances, which is good. They reference existing government documents and frameworks, which is good because it shows that they've thought about what's happening in country already, and they're not duplicating or impeding existing efforts. They talk about visits and engagements that they've kind of undertaken to the site, and that's really clearly explained in terms of showing how they will use those site visits to ensure that what they're doing is adapted to the context. And then the only thing that they could probably improve upon is outlining the role that each of the partners played in carrying out this needs assessment. We don't know who carried out the visit in country, and that would be good to know, because we would like to have a bit more insight into how the partnership dynamic works, because we want to encourage equal and mutually beneficial partnerships. So I'll share at the end, as I said, a document that we have that's got lots of questions like this that just picks out the positives and negatives that you might find useful. Okay, so the next thing I want to talk about is the project plan, or the MEL. So what are you hoping to achieve, and how are you going to measure that you've achieved this? So quite often we find applicants have difficulty expressing the changes which they're hoping to achieve. So in our application forms, we generally have a MEL plan, which looks at the changes which the project or the partnership is hoping to achieve over time. So it looks at the overall goal, it looks at changes that they want to see by the middle of the project and changes they want to see by the end. And these should all feed into each other. We also ask people to kind of talk about how these changes might be captured or demonstrated. So in MEL terms, the indicators for these outputs and outcomes. So we find that, though we never ask for this, we always find that the best thought through MEL plans come about where partnerships have developed a theory of change first. So a theory of change is it's basically a kind of illustration of how and why a desired change is expected to happen in a particular context. So it's focused in particular on mapping out or kind of filling in what you might describe as the missing middle. What is missing from you being able to achieve that change that you want to see. And it does this by first identifying the long-term goals, and then you work back from there to work out what steps you need to do in order to reach that goal. And it's quite a useful tool to be able to think through the logic of your project and make sure that you're not missing out anything crucial. So on this page, what I've got is this is just an example of a very basic MEL plan that we've received in an application form. So there should be a logical flow between the changes by the middle and the end of the project. So for example, you can see in this example, A1 is 4 hospitals in the region have 60 people trained in safe surgical practice. So that's the change by the middle of the project. What they then want to achieve by the end, which is 4 hospitals in the region implementing the safe surgical checklist, they directly feed into each other. So you can see the logical flow of why of how they're going to bring out these changes. So it's also important that the targets are reflected in the activity plan. So the activity plan is the specific activities that you're going to do, which will bring about these changes. So it's always good to link the activities to these changes as well. So as a general rule, what we look for when we're reviewing applications is overall cohesion between the goal, the changes that people want to see, the activities planned, the budget and the time frame. So you just need to make sure that all of the various elements of your application form do align with each other. So for example, your activity plan, you say which months you're going to be delivering these activities in, and then that's reflected in the quarters of your budget so that we can see that there's clear alignment there. So the only thing that we think could have been improved with this MEL plan is that they could have specifically included some behaviour change at the outcome level. So with interventions like these, the impact of projects is quite hard to measure and sustain. But if you try and make sure that you're measuring some kind of behaviour change, the likelihood of it being embedded is much greater. And we see that sustainability is improved if you are checking for the behaviour change of those that you've trained. Okay, so the next thing that I know a lot of funders are really interested in at the moment in particular is gender equity and social inclusion. So it's a relatively new area of work for health partnerships. Last year, THET developed a GESI toolkit, which is a really useful guide for health partnerships around how they can include GESI activities in their projects and make sure that they're taking a GESI sensitive approach. So a GESI approach considers unequal power relations and inequalities experienced by individuals as a result of their social identities and how these multiple social identities intersect with each other and can create experiences of vulnerability or marginalization. So what we want to see in are projects that kind of have actions to address these unequal power relations. And good interventions won't just rely on the assumption that because they're targeting a particular population, that means they're taking a GESI approach. So what we see quite a lot is people say, oh, well, I'm running a maternal care project, which is focusing on women. So I'm taking a GESI approach, but it doesn't really look at how kind of the barriers to to accessing these services that some women might face depending on their other social identifiers. So another example is that people say, well, we're doing a nursing project, most nurses are women, so we're taking a Jessie approach. It doesn't quite work like that. Instead, you might want to consider how your intervention can be specifically designed to ensure that groups are not disadvantaged in accessing benefits. So this might include carrying out a Jessie needs assessment, where you can identify some of the barriers that these groups might face to accessing services or accessing training. For example, we've had situations where women can't attend training because they don't have any childcare. So what a project has done is put in their budget for a creche attached to the training, that kind of thing. Yeah, so it might mean budgeting for activities like that, which increase the abilities of certain groups to engage with activities. And it's not enough for it to be kind of a one-off activity. What happens is these activities need to take place, and then you need to continually measure the impact of them to make sure that what you're doing is actually addressing these barriers. It's a kind of a process rather than just a one-off activity. And we do find that if you include specific indicators in your monitoring plans, that really helps, because there's something that's kind of holding you to account to deliver that. Okay, the next thing I wanted to talk about was sustainability. So sustainability of outcomes of projects is really kind of key area for THET, and I imagine for a lot of other funders as well. So we need to know that you've considered how you'll ensure that the impact you've achieved is sustained. So things that might help you demonstrate that you've thought about this. So real buy-in from in-country stakeholders. What role are they playing in the project? Have they really bought into what you're trying to achieve, and how you're going to achieve it? Embedding work within existing systems, so updating policies or protocols within the hospital to ensure that the ways of working that you've developed are embedded within those systems in the hospital. It's not just a one-off training that people are going to forget about. We find that a train the trainer approach is really good, as long as those that you've trained have got the opportunity to actually deliver the training themselves. So occasionally we find people saying that they're doing a train the trainer approach, but the trained trainers never have the opportunity to train people themselves. So how do you know that the training which they've received is actually suitable, and that they have the capacity to then deliver it to others? So we find that the best training models are one where the in-country trainers are trained, I don't know, by UK volunteers, and then the UK volunteers deliver training to trainees being observed by those trained trainers, and then the trained trainers carry out some training and they're observed by the UK volunteers, and then the trained trainers carry it out independently. So I know that I say training a lot in this this line of work, but yeah, it's kind of a cycle of to ensure that the trained trainers really do have the skills to be able to deliver the training. We find that you always have to make sure that you've built enough time into your project to measure the impact of activity, and then make changes if things haven't worked. So we're really big advocates of the PDSA cycle. So plan, do, I can't remember what S is, and then change it if you need to, and don't be afraid to do that. So we always say, if you're going to fail first and then learn from your mistakes, and then you can be sure that what you're doing is actually going to have a sustainable impact. Get buy-in from the senior leadership within the institutions you're working in, and then demonstrate and share the impact of the work that you've achieved, so that people know what the benefits are, and then they're more likely to continue with it. If you're collecting data about X number of people kind of improving their behavior based on the training they've received, then share that with the people that you've trained, so that they can see that actually it has had an impact. And this is quite a big one for us, don't have your project reliant on costly or sensitive equipment that you put into kind of a clinical setting, unless you know that A, it's easy to get replacement parts, it's easy to fix it, and that the hospital is willing to pay for it, because it's all very well putting in some kind of C-arm into a theatre in Ethiopia, but if you're not going to be able to fix that when it breaks, and you don't have the skill, the people with the skills to be able to fix it, it's just going to become a waste of space, really. So obviously sustainability isn't ever guaranteed, and just be aware that it can take a really long time and a lot of patience to be able to achieve change. It doesn't happen overnight, and I find that some of the grant holders kind of get a bit depressed or deflated if what they have done hasn't worked straight away. Don't feel like that, because it is incredibly difficult to have change at this kind of level. So again, just another kind of example of a good answer we've had. So this answer is really good at incorporating quite a lot of those aspects that I just spoke about. So they involve the Ministry of Health, and they have in a meaningful way as well. So they've involved them and received input from them in the implementation and design of their project. So involve them right from the start, just so that they don't just feel like you're involving them for the sake of it. They need to know that they have got a meaningful say in projects. They talk about embedding into existing systems. So they're talking about tailoring the tools that they're using into the specific context, and then this will increase the chance that the positive outcomes will continue. And they also talk about gaining senior management buy-in for their intervention, which is great. And then they are also talking about a training of trainers approach which they're taking. And this for them has involved strategically choosing certain members of the hospital to be trained as trainers, who can then go on to train other healthcare workers during the course of the project. They're not leaving it till the end. They were doing it kind of in the middle of the project, so that they could then measure the impact that these trainers were having on the training. Okay, and then project management. So this seems to be an area that for us, quite a lot of health partnerships neglect slightly. I think it's because a lot of the people who deliver these projects and write the application forms are clinicals. They might not have experience in project management. So what we say is always make sure that there's someone with project management and financial management experience working on projects. Don't rely on volunteers to be able to do this, because it's very time intensive. It can be quite stressful, and there are a lot of moving parts to it. So yeah, make sure that you've got someone who's got the time and the skills to carry out this role, and always budget for them. So it takes more time than you think, and you can't just rely on volunteers to do this. Make sure that you're putting in some money to be able to pay for somebody's time to do this. Some of the most successful projects that we've had, they have kind of external project managers who just deal with the day-to-day financial management and timing and things, and we find that's really beneficial. Yeah, also make sure that there is project management experience on both sides of the partnership. So in the past, we've had just UK partners managing the project management side of things, and that's not great for sustainability. What we're trying to do is build up the capacity of the LMIC partners, so that in the future they can manage this kind of project themselves without UK input, and building up those key project management and financial management skills and monitoring evaluation are really important. Yeah, and then other things that we're kind of looking for are detailed descriptions of the structures that you've got in place to manage your partnership. So things like steering committees, how do you make decisions, how will you, if you, for example, there was a safeguarding emergency, how would you deal with that? Do you have the policies in place to be able to do that? There's some really important details that quite often get left out of application forms. Okay, and then finally, again, this is potentially kind of a health partnership specific area, but volunteers. So volunteers play quite a big role in health partnership projects, and it's really important that you kind of tell us what their role is, what role will they be playing in the project, and how might they themselves benefit from being involved in the project. So we find that with a lot of funders, particularly government funders, want to know why they should let NHS workers go and work overseas for a couple of weeks a year. They need to be able to demonstrate that the learning that these volunteers might bring back to the UK health system. It's quite a nuanced point, but it's very important to a lot of funders. We also always look for what formal structures a partnership has got in place. to recruit volunteers, manage them, and then support them once they return to the UK and while they're overseas. We want to know where they're coming from, what institution they are, what skills they're bringing, why it is that they're being chosen to volunteer with this project, how you'll recruit them, how you'll prepare them for any overseas travel. Like, have you thought about how they might not know anything about life in Uganda? You don't want to send somebody that doesn't have any of this knowledge or skills and just throw them in at the deep end. You need to prepare them for it. And then how will you capture the learning that they receive? So there are always there's always a space in the application form for you to give us this information, but we do quite often find that it's a little bit brushed over, and I do kind of think that's because people might not necessarily have planned the volunteer engagement element of their projects at the stage that they're applying for their project. But yeah, if you are ever applying for a THET grant, do just think about the volunteers that you'll be involving and yeah, what's in it for them, basically. Okay, so that's all of my wisdom that I wanted to give to you. As I said, I can share those documents that kind of go through the application form and pull out all the good, the positives and the negatives that might be quite useful for people. And there's also a similar budgeting one which might be useful. But yeah, do feel free to ask any questions if anyone has any.
Thank you, Bee. That was lovely. Can you do me a favour? Can you stop sharing screen? Perfect. And as we're such a small group, if you feel comfortable doing so, feel free to take off your camera so that we can see you all. If you want to ask a question, you can either put it in the chat or under the reactions tab, you can raise your hand. You see, I've just raised my hand there. And so you can put your hand up if you have a question. And I can't lower my hand now. There we go. I've lowered my hand. But thank you, Bee. That was really, really helpful. And there was lots going on in the chat whilst you were speaking. In terms of the resources, I'm going to send out an email at the end after this event and with a link to the resources. And we'll also put a recording of the session on that website as well. One of the things that came up in the chat was somebody was looking about sharing best practice. And I was thinking about bilateral learning. Why would, why are funders interested in bilateral learning, and how do you express that in an application form?
Good question. It's something which we're really keen to explore. I know our policy manager is really keen to capture all of this. So in terms of bilateral learning, particularly captured on the UK side from volunteers who've been overseas and come back, we find that if you have the systems within whatever institution they've come from, where, for example, they have annual appraisals, we find that capturing the learning which they have gained from being involved in the project is really good. Doing it through formal processes like appraisals. We've also had quite a lot of volunteers on their return to the UK doing kind of lunch and learn type things or presentations to their colleagues, just talking about their experience and what they've learned. We found that during the COVID pandemic, there has been an awful lot of movement of learning both ways. So for example, there was a partnership between Birmingham City University and University Teaching Hospital in Lusaka, and that was a critical care for nurses project, and they developed some the nurses in Zambia developed some really good guidance for critical care nurses on working on the ICU and treating COVID, which then went back to the UK, which was a really nice example of how the learning can go both ways. But yeah, it's quite a difficult thing to capture.
Lovely, thank you. David, you have your hand up.
Thank you. Thank you very much for the presentation. That was really helpful. Two things. You were saying that the usual grant is for 1 to 3 years max, and yet we all know that sustainability is key. And I don't know how you sort of square those things apart from hoping that the funder accepts that this is just a small step in an ongoing process. And and I suppose as an applicant, occasionally we might be tempted to be a tad over optimistic in our goals for 1 to 2 years, and do we have to spell it out to those who are giving the grants that actually we're not going to achieve very much in the first 18 months? Because I sort of feel instinctively I'm not going to get this grant if I'm only going to achieve what realistically I think we can achieve, which isn't very much.
Yeah, I totally agree with you. I mean, I'm a massive advocate for much longer grants because that is how you make the change. But I think particularly if that we're aware that this change takes decades, and so we're constantly saying, oh, this project is great, but it's very overly ambitious, and we know they're not going to achieve that. So quite often what we do is we then, if we like the idea of a project, we'll go back to the applicant and say, look, we know you're not going to be able to achieve this. Can we scale it back a little bit? Maybe as we find that quite often people say, oh, well, the first year will be a pilot and then we'll scale up to 7 other regions of Uganda or whatever. And you think it's just not feasible. It's not achievable. So think small and achieve what you want to in just one hospital, and then see what happens, because as you say, it's impossible to achieve this long-term change in just a couple of years. So yeah, I would much rather a project was not overly ambitious. And we do say, that monitoring evaluation plan that I had in there, it had a goal statement, and we know that goal statement is not going to be reached, and that's not the point. That's just a long-term goal. For example, people say, going to improve mortality rates for I don't know, neonatal births or whatever, and that they're not going to be able to achieve that in a year. It's just that is a part of a wider program of work that they might eventually feed into.
Okay, can I ask one other different question? So I'm one of these representing one of these small civil society organisations that THET are taking under their wing at the moment. And, we're tiny, we are all volunteers. So the idea of hiring some project management time is really sort of impossible for us. We just don't employ people. It's one of the joys of running a very small organisation that we don't employ, so we don't have to worry about all those employment things. But it does limit our ability to apply for things if we can't demonstrate that we've got a tame project manager on hand. It would be different if we are successful in finding a UK health training institution to sort of make a sort of triple partnership, but we don't have that at the moment. So I feel that small CSOs are quite disadvantaged, really, because we can't call on these sort of resources.
Yeah, I mean, it's very true. I mean, big universities have hundreds of staff that they can just call on like that. But I mean, it's very difficult because there is money in the budget for that. It's not like you would have to fund it out of your own pocket. But yeah, you're right. It does disadvantage organizations, and we're aware of that. I mean, I think Alice wrote in the chat that it's something that she wants to kind of take forward, and we've also thought about it. What we would love to do is have kind of a number of consultants that we could call on to help small institutions who don't necessarily have that capacity within themselves. It's something that we would really like to do in the future, because we know that it's an issue.
Thanks.
But I suppose we do take it into account when we're reviewing applications as well. We're aware of the limitations.
Thanks, Bea. We've got a little bit of a queue forming. So I saw that Alice put her hand up really quickly then, which I assume is no? Shaking your head now? Okay. So we've got, Zach has put in a question, and then we'll come to you, Catherine. So Zach, you have said, could Bea please put or share some of the challenges encountered during program implementation process? Can you see the chat, Bee? Zach, would you like to clarify your question a little bit? Do you know how to take yourself off mute?
Well,
thank you.
Thank you so much for this. I'm very glad to be part of this session. What I wanted to say, I just wanted to maybe some of the clarifications, because I believe as part of partnership development, sometimes when you implement some of the programs, there are some of the challenges, especially when you're forming new partnerships with the grassroots organizations. So I just wanted maybe our sister to share some of the highlights on, since they started implementing this particular program, there are some of the big challenges that they've encountered, or what are some of the program similarities in other regions? Yeah.
Okay. Okay, so just in terms of some of the really big implementation challenges that people have faced, so I suppose lack of communication between the partners and not knowing what each other's expectations are. If they come into it thinking if one partner thinks they're going to be able to achieve a huge amount and the other is not, so it is got a different priority, then that can be quite difficult, particularly when you're working with a new partner that you've not worked with before. So it can actually take quite a lot of time to be able to form these partnerships and develop meaningful relationships with people. I don't think you should underestimate the amount of time that can take. It's quite a broad question. Sorry, there are an awful lot of challenges there. They're all very specific to each of the different contexts. Yeah, I don't really know how to answer that question, I'm afraid. Do feel free to email me after this, though, and I'll have a bit of time to think about some of the key challenges. But I suppose the key thing is that, yeah, don't underestimate the amount of time that it can take. So we've got one particularly successful health partnership working in Uganda, and they've been working together for about 15 years now, and it's nice to see, because what we're seeing now is the partnership is not fizzling out, but the UK partner is starting to take a step back because they're not needed anymore, because the Ugandan partner is able to kind of take on this work themselves, and they're the ones really driving the direction of the work now, which is really great to see. I think that should be the aim of the health partnership, to work itself out of work, I suppose, so that the LMIC partner takes on the work themselves.
That's lovely, thank you, Bee. I think that answered the question. I think we had time for one last question. Catherine, are you?
I'm happy to step back, because what I was going to ask has probably been covered there.
Go ahead. I don't think there's
Right. David raised the issue now, because I'm chair of the Wales Africa Health Links Network. So we're a network of the partnerships based in Wales between countries in sub-Saharan Africa, partners in sub-Saharan Africa and in Wales. And as many people here will know, a lot of those are very small and run entirely by volunteers. And it's the issue about project management skills. So you kind of, if you have those up front, when you're thinking about your project before you even put a grant application or go to a donor, that's where you critically want it. So for us, we've always thought about how can we help those small partnerships get an input of project management, hands-on project management support at that stage. And I think that's something we all struggle with. So I'd really like to work with THET on how we do that. We do have an MOU with THET, which we're just about to well, we just reviewed it. I'm just about to re-sign it of joint working. So that is a key bit. So hearing you talking about that is great. And your presentation was lovely. You know, it's very clear, it's very logical, it's very straightforward. So I really appreciate that. So it's the project management skills for small links. And the other thing is to get new large-scale partnerships up and running. So some of the ones that you're dealing with and some of the longer ones are with institutions that are big, and have got a lot of capacity at both ends. So a challenge for us is, how do we get those big organisations in Wales to become partners? So just kind of to say to you, that's that in terms of increasing the impact of what we do, those are the two kind of areas that I'd be really interested to you know, I don't have any of the answers, and I'm hoping that you've got some.
Yeah, I mean, just on your second point, I find it really interesting. And what we have found is the most successful is start really, really small. So it might be a personal relationship between an anaesthetist in Zambia and an anaesthetist in Wales. And then they involve their department. And then once they have delivered a project or 2 projects together or something, others within that institution hear about it, and then it kind of expands from there. So that partnership that I mentioned a minute ago, that's been working together for 15 years, it's between 2 universities, and they started off just 2 people who had met each other at a conference, and then they each got their kind of departments involved, and now we're seeing it scale up to involve other departments within the university. So I think you can't just go straight in with a university or a hospital to hospital. It needs to be the smaller units within those bigger institutions.
Yeah, just Kath, can I just say one thing? Can you hear me?
Yes, I can.
Yeah,
I think we've got a couple of minutes left, so go ahead, Alice.
Just very quickly on a sort of THET part. I know, obviously, unfortunately, THET have lost masses of funding to distribute out at the moment in the millions. But I think this is a real key thing, that essence, you know, I come from a health professional background and a very, very small charity, and that essence of employing somebody. But I think the need, potentially, I've even broached it with THET, of them providing some of this expertise on a consultancy basis. But I think if there is that need, it's email in and let us all know. But I think that will be a key learning point from these capacity development sort of projects for us to take away. So thanks very much for raising it.
Thank you. Yes, and I've put it in the chat, but just to say that after the summer, Hub Cymru Africa are doing a free project management course. It's going to be an 8-week course of online learning. So if you would sign up to our newsletter, and you'll then get a notification about that course that you'll be able to sign up. So that's also part of this offer that's currently ongoing. Okay, Gary, you've had your hand up, sorry. We have 2 minutes. If we could be quick, please, if we could be brief, thank you.
Okay, last but not least, can you hear me? Yes? Okay, yeah. Okay, thank you. Yeah, my question is, with the THET, the outside the partners, are you with Bill Gates and so on and so forth? I'm looking because the funds are restricted. And secondly, on the SDG items, are you classed as 3, 7, 6? How do you connect yourself with the UN SDG numbers, which I put in the chat box? Thank you.
No, I've forgotten my SDG numbers, but we're definitely connected to the health one, the gender equality one, and there's one other. I think the WASH one. We do a lot of work with antimicrobial stewardship and things. So yeah, we are kind of connected into the SDGs. We also have a working relationship with WHO. So we're one of the organisations in, I can't remember what the phrase for it is, but formally connected to them. So we do kind of have somebody who convenes quite a lot at the higher WHO level as well.
Okay. Kath, can I just make one point, and that is, my question is, with the various things that's happening on this world, the grants are being made now also towards climate change. If you've got a project that is being carried out and you've got some element of climate change in there, it's going to be I wouldn't say more favorable, but that's what they're looking to have from that, the result from that project. Thank you.
Yeah, just on that climate change point, thanks for raising that. It's really important. So before the UK PHS cuts, we did have a stream around climate change, and we know that we need to change the way that we work. So in the past, the traditional model has been people fly from the UK over to Africa, and they fly back, and Africa African fly over to the UK to do these training. And what we're finding is actually that's not something we can continue doing in the same way. So we've got a really big focus at the moment towards being able to deliver this capacity development virtually. And I think particularly the last year, we've really come on leaps and bounds in being able to deliver the same kind of activities, but virtually instead. So I think that's what we're looking at in the future, realistically, less travel.
Okay, thank you.
Lovely. Thank you very much, everyone. And thank you for everyone for your contribution. Bee, that was wonderful. Really, really insightful. And it gave us a lot to think about. I appreciate it. I'm going to try and mop up all of the information that's been going on in the chat and send it out in an email. So keep an eye out for that. I really would be very, very grateful if you could please take the time to fill out the feedback form. I'm putting the link in there now. If you didn't enjoy the event, then let us know why not, so that we can make it better. And if you found the event useful, then please do fill out the form so that we can show our impact, so that we can do more of it. So it'll only take you 2 minutes, but it makes a lot of difference for us. So please do take the time to fill out the form. We find you're most likely to do it if you click on it right now whilst you're still in the meeting, so that then you do it whilst it's fresh in your head. I get the best responses, and you won't forget about us. So if you've enjoyed it, please do support us, because these are free events that we're putting on. So please do support us by filling out the form. We appreciate that. Thank you. And if you didn't enjoy it, you can let us know. All right, lovely. Thank you very much. I really appreciate everybody coming. There are a series of activities happening for the rest of the week. We've had 2 so far, so we've got 2 more to go. Tomorrow at lunchtime, there's a lunch and learn that's looking at partnership working. So that's going to be with SSAP, Akia Mama, Wa Africa, Somaliland Nursing and Midwifery Association, and Forward UK. So that's going to be looking at partnerships and fundraising. And then on Friday, I'm very much looking forward to a celebration event. It's been a very challenging couple of months in terms of funding and fundraising. And we're looking at celebrating the successes of the Wales Africa community in fundraising. So come along and listen to how everybody's been getting along there. So I'm putting those 2 links in the chat. Okay. Thank you very much, everybody, for joining us. I hope you have a lovely afternoon. And thank you, Bee, for your contribution. Really appreciate it.
Thank you
Bye,
very
everyone.
much. Bye.
Bye.